It's very clear that the biggest public health crisis that we have in Pennsylvania, and you could argue in the nation, is the opioid crisis, including prescription drug abuse, heroin abuse, and overdoses. The etiology of this crisis is really complex and multifactorial and goes back 20 or more years. It's the perfect storm of different factors. The first was the emphasis in the 80s, 90s, and early 2000s by federal regulatory authorities that public health officials, physicians, and other medical care providers had to do a much better job assessing and treating pain. And that included acute pain and chronic pain. And unfortunately, the expectation developed that not only would we assess and treat pain, but we were somehow going to eradicate pain. At the same time was the development of extremely powerful and long-acting opioid pain medications that were unfortunately marketed that they would not be addictive to patients with pain. And that has been proven to be completely false. They are very addictive. And so the use of these opioids went up 400% over the course of 15 or 20 years. Patients became dependent and then perhaps addicted to these medicines. And then much of the medicines became diverted as well into the community, leading to more addiction. And the third piece of the puzzle has been the influx of very plentiful, powerful, and cheap heroin into the United States over the last 5 to 7 years, which has led to this explosion of heroin use and overdoses. And now, of course, things are even worse with synthetic opioids such as fentanyl. And so we are still seeing in Pennsylvania this perfect storm of different factors continue to evolve. And I think that it's going to be with us for some time, but I think working all together, public health officials and government and public and private stakeholders can work to overcome this crisis. So a warm handoff is a facilitated referral for treatment. And so we have worked in Pennsylvania on rescue, on distributing naloxone, a life-saving medication that reverses overdoses. And under a statute, Act 139, passed at the end of 2014, as Physician General, actually, in 2015, I signed 2 standing order prescriptions. The first was for first responders to have naloxone, and since that time, they have saved 3,600 lives. And also for the public to have access to naloxone. Now, naloxone is necessary to save someone's life after an overdose, but it's not sufficient. You then have to get the patient into treatment, and that's where the warm handoff comes in. So yes, we have developed a warm handoff clinical pathway for emergency departments to use in collaboration with the county drug and alcohol authorities, called the single county authorities, to work to get a patient into substance abuse treatment right from the emergency department after their overdose, and then right into treatment. Now that can include inpatient treatment, detox and rehab, or it could include actually getting someone right into outpatient medication-assisted treatment. So we have been traveling all around the state, all around Pennsylvania, to work with health systems and the county drug and alcohol authorities to perfect this system and to make sure that it's working well. And in many places in the state, it really is working quite well. One example would be in Reading, Pennsylvania, in Berks County, and Reading Hospital, in collaboration with their Berks County Drug and Alcohol Authority, are getting 75% of people who come to the emergency department after an overdose right into substance abuse treatment. That might be the best in the country. And I do feel that that is a model that other states could use. The key, however, is also having enough treatment capability to be able to take those patients right from the emergency department. Now that might include inpatient treatment, so we're thinking of quote-unquote beds, but I think we have to think of outpatient treatment, particularly medication-assisted treatment, more in terms of slots. And I think that this program, with continued experience, will be very successful. So we've had the opportunity over the last 2.5 years to do a lot of traveling throughout Pennsylvania. And so we have gone to urban areas such as Philadelphia and Pittsburgh, but we've also gone to very rural areas such as in Cambria County and Upper Dauphin County and Franklin County and Venango County. And so talking with people suffering from this crisis, talking with patients, talking with families, talking with law enforcement providers, talking with medical providers, I think has been very helpful. We also have had the ability to interact with other public health stakeholders, such as ASTHO, the Association for State and Territorial Health Officials, as well as the National Governors Association, and the federal government in Washington, the Office of National Drug Control Policy, as well as Health and Human Services. And so we really have crafted in the Wolf administration in Pennsylvania a very comprehensive plan that includes prevention efforts. Opioid stewardship is the term that I like to use for that. Rescue efforts with naloxone, the referral for treatment, that warm handoff, and then expanding treatment options. And so this really has to be all hands on deck. This has to be the administration in collaboration with the legislature, in collaboration with the communities and counties, and then working with other states and national organizations to overcome this severe public health crisis. Well, I think it's very important to listen. And so I think that it's important for public health officials to listen to individuals in their community. Again, patients, families, law enforcement, medical providers, hospitals, rehab specialists, etc., and to get a feel from the front line about what they're dealing with, both in urban areas and in suburban areas. But then I think it's important to broaden the perspective and to think regionally and nationally as well, because I think only that way will we be able to get the correct perspective on how to address this unbelievable epidemic, which is really a scourge for Pennsylvania and for the nation. I have to say, though, that I am a positive and optimistic person, and I think that all working together, we will be able to overcome this crisis. Now, I'm also realistic, and so I think that in 5 years, in 5 to 6 years, if we're making progress, I think that we're doing well, and I think in 10 years, hopefully we'll have a handle and we'll be able to much better address and overcome this serious public health issue.